Thank you for joining us today for our webinar on how to make your health insurance work for you. This is part of NORD's series of free webinars for patients and caregivers, and we're glad you could join us, and we invite you to watch for future webinars in this series. We're delighted to have as our speaker today Lisa Massey, Program Manager in NORD's Office of Strategic Planning. As a rare disease professional and a patient, Lisa has extensive experience and expertise in navigating insurance scenarios to assure patient access to care. She was diagnosed with a primary immunodeficiency in 2003 and has been involved for many years in programs and activities of the Immune Deficiency Foundation. Prior to joining the NORD staff earlier this year, Lisa was on staff at the Association of American Medical Colleges, working on Medicare value-based care implementation with academic medical centers. Lisa, I'll turn it over to you now, and we want to thank you for taking the time to speak with us today.
Absolutely, Mary, and I want to thank you for allowing me the opportunity to do this. So I want to give a quick overview of our agenda for the day. I'm going to go through an introduction of myself, some key takeaways. We're going to review insurance and how to navigate authorization and how to appeal adverse decisions. Just to get started, I want to give you all a bit of background as to why I'm leading this webinar. As Mary said, I am a rare disease patient myself with an immunodeficiency. I was diagnosed in 2003, and I've been on a biologic infusion ever since then, and I've had about a dozen different insurance plans. So my most successful insurance approval process saw me get a prior authorization in less than 1 business day. I can't guarantee that kind of result for you, but hopefully giving you some skills and tools that you can use will improve your confidence and help you navigate your insurance with success. So our key takeaways today, we want to walk through how insurance is structured. We want to talk about its different parts and how that affects coverage of tests and treatments. We want to talk about the actual approval process for the kinds of sophisticated tests and treatments that are common in rare diseases. We want to talk about what happens when something's denied. Our goal today is to give you an understanding of how the insurance system works to ease your navigation of the system, as well as to inform you of your rights with insurance companies. In my experience, even just being able to use the right language will change how your insurance representative treats you and can help you get to the right people who can make your decisions for you. So we'll start with a word of caution. As you'll find out as we go through this webinar, much of the information is a preliminary overview, a very generalized representation of how insurance works. As I'm sure you're all aware, plans vary from state to state and from company to company. Some states give you more rights and protections, but this presentation gives you a general idea of what your rights are, no matter your location within the United States. I want to hit the high points here to give you a starting point for navigating your insurance. I'll speak directly to my own experience, but I want to be clear at the outset that I can't say with certainty how your particular insurance works for your specific diagnosis, disease state, or medication. I'm hopeful that my experience will help you gain the knowledge you need on how to get what you need from your own plan. So now we're going to dive into Insurance 101. So each insurance plan has 3 main parts. The first part of your insurance covers inpatient hospital stays and most associated costs. With Medicare, this is considered your Part A coverage. It's really pretty limited to hospital-related things. Sometimes your insurance will pay for everything associated with a particular procedure or diagnosis-related hospital stay in one lump fee. Medicare does this through diagnosis-related groups, also known as DRGs. This is increasingly common in private insurance as well. This means they will pay the entire cost of the hospital stay as one lump sum instead of paying for individual doses of Tylenol and Band-Aids and different things piece by piece. The second part of your insurance is your outpatient professional and treatment fees. This is sometimes referred to as the major medical part of your plan. In Medicare, these items are covered under Part B. There are some rare disease treatments and medications that are covered under this part of insurance. Most durable medical equipment is covered here as well. The third big part of your insurance is your pharmacy plan. This is exactly what it sounds like, and it pays for your medication. This is Part D of Medicare. Depending on how your plan is structured, costs are divided differently among these parts. Your own plan will have its network of hospitals, facilities, providers, and pharmacies. Even different plans within the same company can have very different preferred networks and payment structures. For example, my own infusion medication can be covered under major medical or under pharmacy, depending on the plan specifics and even depending on where I have my infusion administered. It's important to ask questions to your insurance and your provider to facilitate approvals and lower your out-of-pocket responsibility. Your plan's own contracts dictate how much each provider gets paid. These reimbursement rates vary depending on the details of that contract. So in an ideal world, with perfect insurance and a straightforward diagnosis, you have a problem, you go to a provider to seek help for that problem, and your provider prescribes a treatment, a medication, a test, and as a result, you're on the road to recovery. Your plan will send you a notice explaining how your treatment has been covered. This is called the explanation of benefits, also known as an EOB. It is really important to save and track these documents so that you are aware of any changes to your coverage or denials as soon as they occur. These documents can often be found on your insurance website. These also have a lot of valuable information regarding your rights and process information on how to appeal decisions. So make sure you hang on to those and file them. So sometimes the doctor or other practitioner you want to see is not in your insurance's network of providers. Remember how I said earlier that each plan has its own network? This is where that comes into play. The insurance has contracts with some providers and not others to make your care more affordable to your insurance company. Generally speaking, you will have better luck with getting tests, treatments, and visits approved with less hassle and lower out-of-pocket costs if you stay within the network for your plan. Another thing to be aware of, you can go to an in-network facility like a hospital, but your provider at that facility might not be in-network. So it's very good that when you're in a facility to make clear whether or not your provider is in-network specifically. Sometimes there are problems with the prescribed treatments. Perhaps your physician has prescribed a brand name drug and your insurance company only covers the generic. Perhaps your insurance company requires step therapy, which is when they prefer a lower cost drug that has the same outcome or is intended to treat the same symptoms as another drug. An example of step therapy from my own experience is that my provider prescribed a specific brand of steroid inhaler. I later received a call from my pharmacy to let me know that my inhaler had been denied and that the insurance wanted me to try another version of inhaler or have my provider establish medical necessity. This is something we had no idea of until my inhaler was denied at the pharmacy. And we are finding that step therapy is affecting more and more patients across different medication types. Fortunately for me, my provider was fine with the substitution and was able to change my prescription to the preferred medication, and it was covered in the cheapest tier possible for my pharmacy plan. In other cases, where substitution was not acceptable, my doctor has worked to prove medical necessity for what she prescribed over a different drug in the same class. The key element here was knowing why the medication was denied so that we could better handle the situation. Without that knowledge, it's much more difficult to move into approval. As I've alluded to, many rare disease tests and treatments are on special formularies for insurance companies and require prior authorization. Prior authorization allows the insurance company to verify your need for a treatment before you get it to be sure that they will cover it for you. It also ensures your provider that they will be paid by the insurance company for what is probably an expensive procedure or treatment. The best way to figure out if you are required to have a prior authorization for a particular test or treatment is to call the insurance company and ask. Your provider may not have that information, so it's important for you to get the information specifically and get it directly from your insurance carrier to ensure that everyone is on the same page. We all hate waiting on hold for the insurance company to give us information, but it really is the best way to verify and get the best possible information and reassurance that you won't get left holding the bag. Because when we're talking about expensive treatments and things, you want to make sure that as much as possible you adhere to what the insurance company recommends. So when we're talking about verifying in-network coverage for a particular service or medication, we first need to figure out if there is ever a way to have it be in-network and for what conditions. So what I typically do is I call my insurance company with the CPT procedure code or HCPCS HCPCS code, and I ask them specifically what I'm looking for. And that helps them identify quickly by putting it into their computer, and they can pull up information for you. This is especially important if it's a rare treatment or something they don't often run into. Help the people you're talking to as much as possible, giving them all the information you have, and you'll get better information in return. The prior authorization process is one of the most significant differences in naming convention between Medicare and private insurance companies, so I want to point that out right now. Medicare has pretty broad formularies, but sometimes it's difficult to get coverage for brand new therapies or tests. This is when your provider must ask for an exception to the Medicare formulary. This is similar to the prior authorization process in that you must get approval from Medicare or you will have increased out-of-pocket costs. All of the other advice still applies. So when you're navigating this authorization process, proactive engagement is vital. You have to know who the players are. You want to get direct phone numbers or specific agents when possible. Sometimes it's not possible, but always make the request. You don't know until you ask. Write everything down. Even if you don't fully understand what's been said to you, write down as much as possible and ask questions so that you can share the information with everyone as needed. Sometimes you won't understand what the insurance company is talking about, but your provider might. So I always recommend having a notebook handy to record that information that is shared with you, along with dates, times, and names of whomever you spoke with. This will help you remain organized and understand who you've talked to and when you talk to them about what topics. And this helps when you're going through later steps in the process to make sure that everyone has the same information. Don't be afraid to pick up the phone. You can check in every day. There's no rule saying that you can't be incredibly annoying to your insurance company. It's okay. I've had situations where I even checked in multiple times a day to follow up and to create a sense of accountability and urgency. Depending on what approval you're waiting for, being a human that they've spoken to several times can make a difference, especially if they know you will call back. Ask about action steps, who is responsible for doing what, and when you can expect it to be completed. After that benchmark has passed, check in. It's not the most convenient way to get things done, but following up can help you feel more in control of what can be a really challenging and confusing process. This process can take anywhere from days to weeks, but it's important to be actively involved and know where the process is and know what is needed to move forward. Find out where those bottlenecks are. Did someone send a fax that was not received? Well, that would explain why a form was not filled out or certain lab tests were not received. When you engage and are an active part of the process, you understand more of what needs to happen, and you can help smooth things out. Sometimes you are the only one who can expedite things and make sure that the right people at the provider are speaking with the right people at the insurance company. So sometimes, even with the best of intentions and you've been active and you've been really engaged in the process, you have a problem. You've requested a prior authorization or had a service or procedure and it's been denied. But don't worry, there are steps you can take to help reverse these adverse decisions and reduce your out-of-pocket obligation. First of all, let me start by saying you do have rights here. The first layer of appeal is the internal review or appeal. You have the right to request this appeal or review, and I would suggest requesting that your insurance contact an appropriate expert in the specialty responsible for your treatment. Often requesting a peer-to-peer review with someone who is qualified to make treatment decisions for your disease will end in a better result for you and can help your provider navigate future insurance issues. The second type of review is external. You have a right to an external review of any denial for medical judgment that your provider disagree with, any determination that a treatment is experimental or investigational. I will note here that this often includes off-label use, or any cancellation of coverage based on your insurer's claim that you gave false or incorrect information when applying to the plan. Depending on your state, these reviews are handled differently, but you can find information on how your particular state handles these reviews on your state's insurance commission website. That website can also provide you with information on how to file a complaint and how to navigate the process. So when you're making these appeals, there's always some sort of time limit. That varies from state to state, and depending on where you are in the process, it'll be a different time limit. But it's important to stay on top of these things and apply for an appeal at your earliest convenience. You want to make sure you have information and can easily supply what the insurance company needs to approve your test or treatment. There are several things that you can do to help make sure the insurance company can just check the appropriate boxes to make sure things lined up in your favor. The first thing you can do is to make sure your provider has sent all of the information required to the insurance. When lab data or medical necessity information is missing, it's difficult for an insurance company to justify approval for an expensive test or treatment. One way you can do this, and that I've done this, is I've Googled the name of my insurance company, the name of my treatment, and the name of my disease. That can lead you to medical necessity policies. You can also look up medical policies from your insurance company on their website. Most of them will allow you to input and get their policies so you understand what lab values are needed to justify what tests or treatments. You can also make sure that your provider has everything they need and has supplied what they need to make sure that your treatment or test is in-network. These things make a big difference for your eventual approval. Why? Because each insurance company typically has very specific requirements for qualification. If you can figure out what piece of information was missing, you can ensure a more smooth path to a successful appeal. So where do you start? Who can initiate these appeals? You can. Your provider can also initiate them on your behalf. Regardless of how the process is started, there are some things you can request. As I've indicated before, when your insurance reviews your case, you should request that a physician with the same specialty as your treating physician is part of the review. This is important to make sure that you have someone on the insurance side who can actually understand the need for the procedure, test, or treatment. Ask for their name and credentials, and you guessed it, write that down in your notebook. Ask them about the process and what to expect. Also, I've seen a lot of interesting memes about appealing insurance denials. and most of them are full of half-truths. There's no one guaranteed trick that will be a magic wand granting you instant approval. I've had some pretty fast turnarounds, as I've mentioned, but it's never instantaneous. Remember, this process takes time, and part of that time is spent making sure that your case is adequately reviewed. If you go in knowing your rights, are able to provide information about your condition that requires the specific test or treatment in question, and you're direct about what you need, you can help initiate appeals processes or encourage your provider to do so on your behalf. Don't panic. You're not alone, and you're definitely not the first person to have to navigate denials with a rare disease. So take a deep breath, take out your notebook, and prepare yourself to calmly state your case before you pick up the phone. A calm head and a clear voice helps a great deal. And we all know these are very emotional issues, and it's easy to let that emotion get the better of you, whether it's nervousness or upsetness because of this denial in the first place. It's good to take a deep breath and just prepare yourself. Remember how I said keeping those EOBs and that documentation was important? This is where that comes into play. Once your health plan has issued that final denial, you can move to external review. You have 60 days to file such a review request in writing. So that EOB with your final decision on there will have information on how to appeal and the contact information for the review process. Depending on your plan, your case will be reviewed by a state, federal, or independent reviewer. This reviewer will take your documentation and your plan's documentation to make a final determination of your coverage. So if you've made all the notes, kept all of the information in order and organized, you can easily hand a packet to an external reviewer and say, this is all my information, here are my lab tests, this is why we need this, and it makes it much easier. So these are the things you can do to make sure you have your information on file and ready to go, because if you're able to present an organized case, it's much easier for them to see that your need for a specific test or treatment is justified. So before we go to your questions, I want to point out a few good online resources where you can find reliable and correct information. I mentioned that insurance rules vary by state. The way to find out about your state's specific process is to contact the Insurance Commission. You can find them through the National Association of Insurance Commissioners. Healthcare.gov has a ton of valuable information on how coverage works. They also have a really helpful glossary of terms. Whether or not you purchased your insurance through a marketplace, you have access to all of the information there, and it really is great. And if you've not gone there and looked through the glossary and some of the information, I highly recommend that. Medicare.gov is the best place to go for further information about Medicare. They have a lot of resources on various parts of Medicare on their website, and it's a good place to start. They have information about coverage, they have information about how to appeal, they have all the forms you're going to need, so it's really the #1 best place to start. Also, I will recommend to rely on your own patient organization. They've often navigated these waters, or they know someone who has. Definitely reach out to them and ask if they have specific ways that they can help you navigate the process. I want to wrap up with the most important takeaway of today's webinar. If you've tuned out, you have not listened up to now, this is the most important thing. Making sure you or your loved one gets the treatments and services needed matters the most to one person, and that's you. So you can own this process, and you should own this process for yourself. With that, I will turn it over to Mary for the Q&A.
Great. Thank you so much, Lisa, and thank you for those really helpful insights. So we have collected several questions both before and during the webinar, but we'll get started on these so we can try to answer as many as possible. So first question, with high insurance, co-insurance and deductibles, what questions can patients ask to possibly reduce costs of procedures such as injections and meds or reduced number of visits?
That's a really good question. So we all know that rare disease is expensive, and it often involves a lot of visits to a lot of ologists, and the cost really adds up. So the first thing I would recommend is an honest conversation with your doctor. So talk to them about your challenges in accessing your medications, your tests, your treatments, whatever it is that's creating a barrier, and find out if they have specific programs or services that they may be able to offer help. And that's important because many hospitals or health systems have programs in place. So the second thing I would do is to talk to your insurance company. Make sure you're receiving your medications in their preferred method. If you're using their preferred pharmacy and their preferred method of treatment, or you can combine all of these things, you can maximize your benefits and make sure that they're paying the maximum amount and you're paying the minimum amount possible. You can also ask whatever pharmacy or provider that you're using about financial assistance programs. And hospitals and pharmacies usually have these programs, but it's not something that's often advertised because there are restrictions on them advertising those programs. And the third thing I would do is to contact the drug manufacturer. So a lot of manufacturer websites have copay cards and programs and all sorts of different supports that people with private insurance can use to reduce their out-of-pocket burden. Finally, you can contact NORD because NORD has some assistance programs that are tied to specific diagnoses. So, definitely look on NORD's website. There are lots of different programs for lots of different disease states, so definitely check that out as well.
Great. So next question. We've received several questions about off-label drug use. Do you have any insight or advice on off-label drug use and how to make your case to the insurance company?
So this is a sticky issue for sure, and many patients run into it because drug manufacturer may produce a drug for a blockbuster reason, and that's the only on-label use of that medication. But it can be used for a wide range of medically accepted indications, but with rare diseases, it's often not cost-effective to do the clinical trials that they would need to do to make these indications be on-label. So often, a lot of rare diseases will use these things off-label. So I would discuss with your doctor and find out how they're using the particular drug or treatment or other intervention and how their other patients are getting things covered. Because sometimes you can learn from your doctor's experience on how things are being covered to make sure that you're incorporating as much knowledge as possible. I would also say you can look into things like case studies, or if your disease group has information on how your fellow patients are accessing treatment and what this has done for them, it can really be helpful to make your case to the insurance company. I can't necessarily speak to specific medications or conditions, but generally speaking, when your insurance company denies something as experimental, you can appeal that to an external reviewer. And that's when having all that information from your provider and your patient group and other patients will make a difference, because you can appeal to that external reviewer and say, hey, these people are using this drug, this is the benefit, and this is why my provider thinks, this is the necessary drug for me.
Thank you. This questioner says, I am interested in learning more about drug approval parity for Part B and Part D drugs. How do I successfully overturn the so-called compendium issue for off-label Part D drugs?
So this is a really specific question, but I think there are some general things that I can talk about that will help navigate this sort of issue. So Medicare basically has these compendiums, which are basically big books of drugs and how they're used and how the medical indications for all sorts of different drugs. And as you can imagine, not every treatment appears in whatever edition of this compendium that they're using. So what you'll need to do is you'll have to go through the 5 levels of appeals, one after the other, and those appeals start with your regional Medicare administrative contractor, which is also called a MAC. That's who you'll appeal to. They handle the first stage of these appeals, and they also make local coverage determinations. The second layer of appeal is to a qualified independent contractor. So if that QIC makes a negative determination, your appeal next goes to the Office of Medicare Hearings and Appeals, and it'll be reviewed by an administrative law judge at that point. The fourth layer of appeal is the Medicare Appeals Council, and the fifth and final level of review is by a federal district court. So as you're going through the Medicare appeals process, you basically have 60 days between these to appeal a decision. And this is where my recommendation of going to Medicare.gov, all of the forms you need to make certain appeals for formulary exceptions are located on Medicare's website. And you can find them pretty easily if you just either look on Medicare.gov and search appeals, or if you Google Medicare appeals. You can find the appropriate forms. One important thing I will add here is that you can also engage outside help with appealing Medicare decisions. So let's say you're trying to get a drug into a formulary exception. One thing you can do is you can have someone like from your patient group go through the process with you, and there are forms on Medicare's website that you can appoint an external representative. So this outside representative can be helpful navigating the process and to help you make your case, because this kind of stuff is really complicated and it's hard to do alone. So whenever you have the opportunity to engage outside help, I would definitely recommend doing so.
Great. This person asks, how do I receive insurance reimbursement for an infusion given with home health? When I receive it at the doctor's office or at a hospital, it is paid for in full, but not with home health.
So this is actually, this is an interesting question. It's very close to home for me. Site of care is definitely a really important issue for patients who get infused medications. I've had to change my site of care based on different insurance policy requirements. Even from year to year, sometimes my plan will change, and that'll change where I can get my infusion. So I definitely appreciate this question. So home health services are just sometimes not covered, and that's really unfortunate. Or they're only covered under very specific certain circumstances. And Medicare actually doesn't cover home care very well unless you're declared homebound. There are a few exceptions to that, but in large part, if you have Medicare, it's difficult to get home infusions approved. For private insurance, on the other hand, there's usually some way to get home infusions covered. Sometimes it's as simple as figuring out which in-network pharmacy actually can do that for you. So you'll have to call the insurance, find out the pharmacies, and then call the pharmacies, and it's a whole process. But if you want to get those home infusions, it's important to go through the process and find out who's in network. Because often they will cover home infusions just for the simple fact that it's cheaper than any facility or doctor's office or whatever. It's much cheaper. For example, in my previous insurance plans, I could order my medication in a couple of ways from different pharmacies. But for one of the in-network pharmacies that actually had the lowest out-of-pocket cost, I could only receive my infusion at home. For the other, I would have been able to receive my infusion in a doctor's office, but it would have been a 20% coinsurance instead of a $50 copay. And I'm sure, as you can imagine, I much prefer the $50 copay. So my recommendation is to ask your insurance company what pharmacies are in network for your particular medication, because sometimes they will think it's a specific specialty pharmacy, but it's someone else, and it's a whole circular bit of logic. But stick with it, ask the questions, go through the process, and you'll be able to find the right combination of pharmacy provider and site of care. So definitely keep at it, because it is lower cost and most insurance will cover it.
This person asks, what are the qualifications for Medicare? I have been on my work disability for over 2 consecutive years. Would I qualify for Medicare?
Medicare eligibility is, there are basically 2 ways you can be eligible for Medicare. The first one, and most straightforward one, to qualify for Medicare coverage is to be over 65. Easy peasy, right? The second and more difficult way is to have qualified for Social Security disability or Railroad Retirement Board disability for 2 years. So either you have to be 65 or you have to be determined to be disabled by Social Security. A private plan from an employer doesn't qualify you for Medicare in the way that being on Social Security disability does. So if you are receiving payments from a private disability plan, as the question asker is, I recommend applying for Social Security as soon as possible if you've not, because that's what gives you access. The Social Security determination is what gives you access to Medicare after 2 years' time.
Great. And here's just a question about the role of case managers. What does a case manager at an insurance company do?
So this is an interesting question. And I personally have had varied experience with case managers at insurance companies. Sometimes they're really great and sometimes they're not as great. But ideally, if you're not comfortable with navigating your insurance, these case managers can actually help you understand your coverage, how your coverage has been determined, and help you navigate the internal process for approval. They can even help you with denials if that should happen. So ideally, a case manager would be able to help you prevent a denial in the first place, helping you understand where you are in the process, who's doing what and what they're missing, who's waiting for what, so that you can understand that if your provider, for example, hasn't supplied labs, your case manager can track that down for you and you can lean on them to help you navigate the process. They're often really helpful because they can be the single point of contact. So when you want to make those follow-up phone calls to the insurance company, instead of calling, some 1-800 number and getting the next random person who has an available phone, you'll get the same individual every time, so you won't spend so much time regurgitating your story. So I think it can be helpful. But it's also important for you yourself to understand how to navigate the system because they can't do it all for you. Sometimes the insurance company, especially if you're a heavy utilizer of the system, they'll assign you a case manager, but you can always request one. So if you have a new insurance plan, you don't know how it works, you're wondering how the coverage is determined, you can always ask for a case manager, and your case manager can help you get the information you need to navigate your insurance. So if you don't have one and you think it might be helpful, you can always ask for one.
And here's an individual who asks, why are some Medicare Advantage plans so cheap?
So Medicare Advantage is interesting because it's sort of a combination of Medicare and private insurance. And each plan has its own pros and cons, but the way that many companies make their Medicare Advantage plans more affordable is to actually limit the network of providers. So before you enroll in a Medicare Advantage plan, I would make sure that your lead specialist and primary care doctors are part of your plan. And that actually goes for any plan, really. Most insurance company websites will allow you to use their Find a Provider tool before you're enrolled in a plan. so that you can actually put in your plan information and find out whether a particular provider is in network. And it's important to do that before you enroll in a plan, because often if it seems too good to be true, it probably is, because you'll want to go to a specialist or something and they won't be in network. Because a lot of less expensive insurance plans will have these kind of extremely limited offerings. So they're able to negotiate much better prices for themselves. So be careful of that, and definitely lean in and use the provider search tools on their websites.
Great. This individual asks, it's sometimes recommended that a patient with rare disease go to a hospital or other center that specializes in the treatment of the disease. Are there any options with the insurance company if these centers are not in the network?
So this is a problem that comes up a lot with rare disease treatment, and it's something that is definitely important to NORD, that you have access to the specialists that you need. So one thing that you can do is you want to file for, before you go to an out-of-network center or specialist, you want to engage your insurance company and say, hey, my doctor can't treat me. My in-network physician and all of the in-network physicians can't treat me for this very specific rare disease, and so I need to go out-of-network. And you can get out-of-network waivers. It takes time and energy and dedication, but you can do it. And I would recommend that instead of asking for forgiveness later, you want to go in with an out-of-network exception for these providers before you go and see them.
Here's a question related to step therapy. If you change insurance companies after going through step therapy, how do you inform your new insurance company, or do you have to go through this all over again?
Yes. So depending on the insurance company, it can be as easy as your doctor just saying, yes, this is medically necessary, and this is why. And sometimes, you know, I failed a particular nasal spray in high school. My insurance plans preferred nasal spray, but all my doctor had to say was, she already failed this, this is the year she failed it, and the insurance company was like, okay, we can move on. With more expensive treatments, those justifications become more difficult, but I would say work with your provider, ask them questions, and make sure when you're on a step therapy path that you document the problems. And this is something that's really important, like let's say you're having some sort of side effect from a medication, make sure you document that. Make sure that your doctor documents it, because that's how you can prove to the next insurance company that you have in fact been miserable on this one particular medication, so that they'll approve the more, the higher acuity medication.
Thanks. You've talked a bit about off-label, but we are getting a few questions along the lines of how do you go about getting approval for treatment with a drug that is off-label for your condition, but FDA approved for other conditions?
That's where it's important to really engage your provider, because your provider can make that case. And if they're prescribing a medication that's off-label, they should be able to tell the insurance company why you need that particular medication or treatment. And it may take several appeals, and it may take an external review, but definitely lean on your provider's knowledge for that, because they'll know why you're looking for a particular treatment, and they can better explain it to the medical professionals at the insurance company or to the external reviewers. Because if for off-label usage, often the justification from the insurance company is that it's experimental or an unproven treatment or any number of other things, and your physician can say, I disagree with that, and this is why I disagree with that. And they can provide medical literature citations and things like that, and that will help the external reviewer reverse that negative decision.
Here's a listener who asks, during the presentation you discussed providing codes to insurance during prior authorization. How do you get these codes?
So I fire up my Google machine, and what I do is at this point I've memorized my HCPCS code for my infusion. But what you do is you can Google HCPCS and the medication or procedure, and that will often give you the information that you need. So it'll give you like for example for mine is a J code, and so it's J whatever, and then you use that information. That's the code that they can just put into their computer and it spits out an answer. So if you can give them the HCPCS code or the CPT code, and those are all, you can find them on the internet, like I said, on Google, but use your condition or your particular medication name to Google those.
And here's this is a fairly long question, but let me see if I can summarize it. This is from a mother whose son is having difficulty getting his insurance company to cover his emergency Solu-Cortef vials as a prescription, and they're refusing reimbursement, stating that this is for hospital use only, but her son actually has used emergency injections prior to ER visits on approximately 8 occasions, and she believes he might not have survived a few of those crisis events without the injection prior to arriving at the ER.
Yeah, that's a tough one. It sounds like the insurance wants to cover it a very specific way. And so how I've navigated that sort of thing is to call the insurance company and ask them how you can access the medication, because depending on the pharmacy and how it's billed, that can change how your insurance covers it. So if your pharmacy is billing it as a hospital medication, your insurance company is never going to approve that for an outpatient administration. So what you want to do is talk to your provider and your insurance. Like ask your provider who's providing the steroids for that injection, and ask them how other patients are getting it covered. And ask your insurance company if there's a particular pharmacy that you need to use for that injection, because sometimes it's as simple as, oh, you got it from CVS and you need to get it from Walgreens instead. So ask the questions and make sure that before you fill a prescription that it's in network, so that when you have these drugs on hand, because it sounds like they're on hand, so when you have them on hand, you want to make sure that when you pick up your prescription or when it's mailed to you or whatever the process your insurance company wants, that's when you need to verify that it will be in fact in network.
Do you know if medical care in a foreign country is considered out of network? Can it ever be covered?
Most of the time, no. We can look into it. So email that to education@rarediseases.org and we can look into it some more. But a lot of individual insurance policies will say yes or no to whether or not they cover you in other countries, and for what reasons. Like if you're traveling abroad, some insurance will cover you for emergency things, and some won't. So that will vary by policy. But definitely if there's something specific that we can research for you, send that to the education@rarediseases.org email address and we can look into that further for you.
And we are running toward the end of our time period. I'll just try to do one or two more final questions here, and we have gotten quite a few.
Mary, I wanted to make a quick plug for anybody who's experiencing step therapy issues. This is something that NORD is really paying close attention to because insurers are using it in ways that are not always entirely appropriate. So if you're running into step therapy issues, please do email the policy team from NORD, so policy@rarediseases.org, and they can help give you more information on step therapy specifically and some insights on how to navigate it.
Okay, and we'll do one last question here, and then I just do want to underscore, please feel free to send your questions by email later. I'm sorry we didn't have time to get to all of them, but we've had some really great questions. This last one is, how do you prevent unexpected out-of-network provider who is brought in perhaps behind the scenes?
Yeah, it's hard to ask if your surgeon is in network if you're receiving emergency surgery. So I definitely have heard this from a lot of patients, that they'll be in the hospital and they get, a CT, and the radiologist who reads the CT is for some reason out of network. And that is something that you should appeal to your insurance company and say, I had a reasonable expectation that this provider would be in network because the facility is in network, and let the insurance company and the facility fight it out, because often, it'll be like a small blip in the contract period or something like that that can make someone out of network. But definitely when you can ask the question about providers being in network, ask the question. And when you can't, if something happens after the fact and you had no knowledge or no control over who your provider was, so emergency situations, something that happens behind the scenes, you can make an appeal to the insurance company and say, I had a reasonable expectation that because this facility is contracted with your insurance company, that this would be covered, and it's not. So that's a good reason for appeal, and that's what I would do. So ask the questions, make the appeals, and don't let the facility just brush it off. So I think that's the end of our time. So I'm going to go ahead and wrap it up and say thank you all so much for attending and listening to me talk, and I'll turn it back over to Mary.
Thank you, Lisa, and thanks for your presentation. Again, if you had a question that didn't get answered, you can send it to education@rarediseases.org. Thank you so much for joining us. Have a great day and happy holidays.